diabetes. So understanding, prevention, and living well. So if we can go on to the next slide, please. So yeah, as I said, I've been working in the NHS for 17 years, but then I also carry out GP consultations, including health assessments, which can be up to an hour long, can be quite comprehensive and include cardiovascular health and diabetes prevention or management. And this is a passion of mine and is very much something that I love to talk about. So apologies if I go off on tangents and get too excited. So without further ado, let's get right into it. So we're going to talk about what diabetes is, the two main types of diabetes that you may have heard of. Then we're going to move on to how we can prevent it with various lifestyle measures. We're going to then talk a little bit about self-management as we go along if you do have a diagnosis, and the kinds of times that you might need to seek additional medical help, or things that you might notice in a co-worker that prompt you to ask those additional questions about, do we need to get some help for them? So next slide, please. So what is diabetes? So it's a long-standing condition where blood sugar levels are persistently high. So unlike a chest infection where you have a course of antibiotics and then you are completely better at the end of it, potentially, this is something that when you're diagnosed with it, it's about managing it over the long term. So sugar is supposed to move from the blood into our cells to provide them with energy. So whenever we eat, that sugar is absorbed through the gastrointestinal tract and circulates around our body. And then the cells take it up to use it as energy. And the signal that is given from the body in order to do that is the hormone insulin. It tells the cells, suck up that sugar from the blood and let's use it to power our cells. Now, if the body doesn't produce insulin, or it's producing insulin but it can't use it effectively, our blood sugar levels remain persistently elevated, and then that is eventually what leads to our diagnosis with diabetes. Persistently high blood sugar damages our blood vessels and our nerves over time. So diabetes in its own right doesn't have to mean lots of complications. However, left untreated, it can lead to a number of things. So untreated or poorly managed can increase the risk of cardiovascular disease, such as heart attack, stroke, heart failure, foot or leg ulcers. It damages the kidneys, so the kidneys stop working, and ultimately you have a need for dialysis, where a machine is physically filtering the kidneys for you 3 times a week because your kidneys can no longer eliminate waste products for themselves. It can also lead to sight loss because it can damage the nerves at the backs of the eye. We call that diabetic retinopathy. And it can also result in nerve damage, which causes numbness, burning, tingling, or shooting pain, typically in the extremities, so the hands and the feet. That can be extremely painful and is it's notoriously difficult to treat with traditional pain relief. So best to prevent it in the first place. So how common is diabetes? It is one of the most common chronic diseases that we have in the UK, and unfortunately its prevalence is increasing. So in 2023 to 24, approximately 4.6 million people were diagnosed with diabetes in the UK. And of those people, approximately 90% of them were diagnosed with type 2 diabetes, which is the one I want us to think of as more to do with lifestyle. So it's estimated that there could be up to 1.5 million people walking around the UK at the moment with undiagnosed diabetes, specifically type 2. So next slide, please. So type 1 versus type 2 diabetes. So type 1 diabetes, this is an autoimmune condition. So essentially, the body's own immune system is attacking the pancreas. The pancreas is the organ in the abdomen that produces insulin. And if the pancreas is damaged, then insulin can't be secreted. So if there's no insulin circulating to signal to move the sugar from the blood into the cells, then the only treatment that's available is lifelong insulin, and that's delivered via injection multiple times a day. It's usually diagnosed at a younger age, so we might see children, teens, people in their early 20s. But at some point, the pancreas essentially waves the white flag. It has no more insulin to produce because the body's own immune system has damaged it and ruined it beyond repair. We then have type 2 diabetes. This is the more common type of diabetes. And this is linked to insulin resistance, but it's also paired with reduced amounts of insulin being reduced from the pancreas. So there is some insulin circulating around in the body, but it just isn't being used effectively. The cells are immune to the sound of the insulin signal. It can be more common in certain ethnicities, but lifestyle factors, which are obviously our modifiable factors, are the things that we will focus on more. So we would manage it with advice regarding dietary and lifestyle changes to be made. We might prescribe tablets. We have a number of different tablets at our disposal and different medications. It's an ever-evolving field. But ultimately, if diabetes does not come under control with all of those things, our final step is insulin, which is, again, as with type 1s, that's injections every day, multiple times a day, and that is lifelong. Just before we move on to the next slide, I just want to mention something called pre-diabetes, which some of you may have heard of. So this is where you have not yet been diagnosed with diabetes. However, your blood sugars are higher than normal. And so your GP might say to you, you're in the pre-diabetic range. So that's a really crucial time where you can make these changes before you're then diagnosed with full-blown type 2 diabetes. Oh, I'm sorry to hear that, Tony. Well, we'll talk about that in a minute, and what we can do about pre-diabetes and getting you back the other way. So in terms of our risk factors, so family history. If one or both of our parents has diabetes, if one of our siblings has diabetes, the risk that we're going to have it as well dramatically increases. Being overweight or in the obese body weight category, especially if that weight is distributed around our middle. Weight that's distributed on the hips, while we might not like it and we can't fit it into our clothes as well, it's not dangerous fat in the way that fat around our waist is dangerous. Fat around our waist is what we call much more metabolically active. So it secretes many more harmful chemicals, which it's kind of a domino effect. You know, we've got the fat there, the hormones all become out of kilter, and then we can also develop high blood pressure, as well as diabetes and everything else. So avoiding weight around our middle, or if we have it, trying to reduce it is key. There is an increased risk among certain ethnic backgrounds. So obviously we've got to factor in, we've already said family history plays a part, but certain ethnicities will distribute fat towards their middle rather than towards their hips, as one of the many reasons that this can be more of an affliction of different ethnicities more than others. Also, among certain ethnicities, your blood sugar control doesn't have to be as bad to tip you over into diabetes. So Afro-Caribbean, Southeast Asian, Hispanic ethnicities can all be at increased risk, but they don't have to be as overweight as a white European, for example. It's just about the genetics of different metabolisms with different ethnicities. Poor diet. So I've been guilty of this one. We all grab convenience food when we're in a rush, don't we? Physical inactivity, another one. We're supposed to do 150 minutes a week of moderate exercise, but post-COVID, I feel as though life has just exploded and it's quite hard to try and carve out that time. Certainly if you have a desk-based job and you're working long hours. So trying to figure out how we can factor this in to try and reduce that risk. Increasing age, just another thing we can add to the list as we get older, another thing that we've got to try to avoid. Poor sleep, stress or shift work. So, you know, I've worked shifts. When we're exhausted, we reach for the wrong kind of food. We reach for processed food. We reach for sugary or carbohydrate-rich food. But it's not just that. There's also all the complexities of the different hormones that come into play when we're tired or we've been doing shift work that can then increase our risk of diabetes. Polycystic ovaries is another one. So where there's multiple cysts in the ovaries, it's unfortunately not just the ovaries and fertility that are potentially affected. It also deranges your blood sugar, which then increases the risk of tipping you into diabetes. And then finally, it can be a doctor's fault. So certain drug treatments. So steroids, beta blockers and statins are some of the most common drugs that we know that can artificially elevate your blood sugar. And Then certainly with beta blockers or statins, which are things that people might need to take day to day for like heart failure, beta blockers, or statins is to lower cholesterol. With those medications, it's then like a risk. We need to like weigh up the risks and the benefits and think what other things can we modify to try and improve blood sugar and stop someone tipping over into diabetes. Could I have the next slide, please? So these are the symptoms of diabetes. So increased thirst, frequent urination, slow healing cuts and sores, fatigue, blurred vision, or unexplained weight loss. Some of the other things that some people notice, so skin tags, particularly around the neck, or areas of increased pigmentation, which can be found around the neck and the skin folds and under the arms. So there's some of the more common causes, more common symptoms or signs that you might have underlying diabetes. Of course, it's really important to say that some people don't feel anything. So much like with high blood pressure, you feel absolutely fine. And it's just when you have a routine health check that actually something comes to light and there's something to work with. So just please do bear in mind these for yourself and for your co-workers, though, as the most common symptoms to look out for. So moving on to the next slide, please. So when it comes to diagnosing type 2 diabetes, we've got various different blood tests that we can do in order to do that. So the most common measure is something that we call HbA1c, hemoglobin A1c. So it's essentially looking at your red blood cells circulating in your body and how much sugar is attached to them. And this measures your average blood sugar levels over the previous 3 months. So it's actually a really clever test. And if you have a result of 48 millimoles per mole or higher, that indicates diabetes. So this is the one where you might have a reading of 42, and that's the pre-diabetic range, and we want you to be in the 30s or the 20s. So that's measuring your blood sugar control over the previous 3 months before the test. That's the most common one that we as GPs will do. The next test is a fasting plasma test. So you have nothing to eat or drink other than plain water for 8 hours before the test. And then if you have a blood sugar level of 7 millimoles per litre or higher, that suggests that your fasting blood sugar levels are still running too high, and therefore is diabetes going on. At that point, we probably would do an HbA1c to look at your blood sugar control over the previous 3 months, rather than just thinking, oh, yesterday they may have had like quite a sugary meal and they hadn't fasted for quite long enough or something like that. And then the final test, which is a little bit more laborious and isn't done as much, is oral glucose tolerance test. So this is where you take a fasting blood sugar measurement, you consume a very sugary drink like original Lucozade, and then your blood is taken 2 hours later. And we want to see that your blood sugar level, your body has been able to essentially suck all of that sugar out of the bloodstream and it's gone back into normal range. And if after 2 hours it still is 11 millimoles per litre or above, again, that indicates that there's an impairment with your body being able to take the sugar out of the blood, and therefore diabetes is diagnosed. Right, could I have the next slide, please? So prevention. So regular physical activity, I can't stress this enough. And I say this as somebody, as a GP, I am largely sedentary, except when I go to the waiting room to get patients. So regular physical activity. Studies are now suggesting that rather than being the kind of person that might walk your dog for an hour once a day or go to the gym for an hour or whatever, regular movement breaks throughout the day to try and account for different blood sugar peaks and troughs are actually the best way to do this. So I say to all of my patients, when you've finished eating, straight away, stand up and move around for 10 minutes. So you don't have to do anything too strenuous, just walking is enough, because the biggest muscles we have in our body are in our legs, and they need energy in order to keep contracting. So as we're walking, the muscles in our legs are essentially acting like sugar sponges, and they're pulling the sugar from our blood and using it in the cells to keep the muscle contraction going. If you can't stand up and walk around, if you're doing a lunch and learn like today, then the other thing that I suggest that people can do is like heel toe raises, because at least then you're activating the muscles in your calves, going up and back down, up and back down. And for about 10 minutes, that can also have the same effect of leveling out the blood sugar and using those the leg muscles as sugar sponges. The next one is weight management. Easier said than done. But with a combination of moving your body regularly and having a balanced diet that is very high in fresh food, in the form of like protein and vegetables, so chicken, fish, tofu, cheese, lentils, they're all high protein meals. High protein and high veg is a really safe way to prevent diabetes. Have your carbohydrate as the last part of your meal, because if you've already got a stomach that is lined with protein and with vegetables, then the sugar from the carbohydrates is also released more slowly, and so it takes less of a toll on your blood sugar. So carbohydrates is the last stage of your meal, please. Avoiding processed foods. This is particularly tricky for me. I do love a McDonald's every now and again. But yeah, there's little nutrition and it's just filled with chemicals and fat. So yeah, certainly not something that you should be doing regularly. It's more of a treat if you really can't kick it all together. Stop smoking. This is another way that the blood vessels in the body can become damaged. And then when blood vessels are damaged, the risk of diabetes, heart disease, high blood pressure all increases. They all kind of go together, unfortunately. Reducing your alcohol consumption. This is a huge one. So alcohol, the fermentation process essentially is sugar. So you're just taking in sugar with no additional nutrition. And then because it's liquid, it's absorbed into the bloodstream very quickly. So you have this massive hit of sugar going into your bloodstream every time you have an alcoholic drink, and your body can't physically get the sugar out of the bloodstream quickly enough. Over time, this will lead to an increased fat around your middle, and then again, diabetes. Prioritizing sleep, as I said, easier said than done for people that do shift work or very busy lives with family commitments and whatever else. But if you can prioritize getting a good 8 hours of sleep, then you will naturally want healthier foods rather than reaching for, sugary tea, sugary coffee, chocolate bars, etc., etc. And then managing stress as well. We are now starting to realize that stress plays such a huge part in so many different diseases, not just diabetes, but different types of cancer as well, and heart disease. So try and do something that's a stress reliever for you, whether that's meditation, walking, gardening, all of these things that are, that can be active, but hopefully not impinge too much on your day as well. Next slide, please. So let's move on now to living well with diabetes. So the next slide, please, Simon. Thank you. So if you have a diagnosis of diabetes, then it's important to take it seriously, adhere to the medication that you might have been given, make the lifestyle changes that have been advised, attending for routine reviews. So that'll typically be with a practice nurse. They would look at your blood pressure. They would make sure your eyesight isn't deteriorating. They would check your urine, and they'd check the sensation in your feet and your hands to make sure there's no nerve damage. And all of this helps to avoid the complications that we talked about at the start of the webinar. In terms of monitoring, so we've obviously got the finger prick test as the picture. Typically with type 2 diabetes, we don't really suggest that people do that. It's more about making the bigger lifestyle changes and then going back to the GP for a repeat blood test to see if the HbA1c blood test has improved, which demonstrates a better monitoring of your blood sugar levels rather than a finger prick test, which is just there in the moment. Could I have the next slide, please? So if we then move on to talking about recognizing problems early, so we've probably all heard of the expression or something, they're having a hypo, worrying about diabetic and the risk of having a hypo. So this is when blood sugar levels become too low. So it can cause someone to start sweating, shaking, become dizzy, confused, have difficulty concentrating. They might seem unusually emotional, so either aggressive, I'd say, and like angry and belligerent, might seem quite tired or just behave quite out of character for them. And the way that that's treated is with sugar to bring the blood sugar levels back up into the right range, because the brain needs sugar to work. If it's left untreated, it is a medical emergency, because ultimately somebody will fall into a coma. With hypos, they typically they're more common in type 1 diabetics, especially when they have a new diagnosis and they're trying to get to grips with the right dose of insulin for them. Other people who, or even type 2 diabetics who start medication and suddenly have a huge drop in their blood sugar levels, can experience those kinds of symptoms as well, because their body is used to running on a much higher blood sugar level. And so even if it's not a true hypoglycemia, you can still have some of those symptoms. So important to be aware of in type 2 diabetics as well. Then we've got hyperglycemia. This is when our blood is too sugary. So essentially the stage, the earlier stage of, before we get the diagnosis of diabetes. So again, we're going back to our symptoms of diabetes. So the symptoms include thirst, tiredness, having to pass urine frequently. You might get headaches, or your vision is a little bit blurred. It sometimes happens if a type 1 diabetic hasn't taken enough insulin, or if they're a type 2 diabetic who is finally on insulin. Blood sugar levels are known to increase in times of illness, in times of stress, or if you've had a particularly carbohydrate-rich meal, so a massive bowl of pasta or lots of rice and bread, those kinds of things as well. And it tends to be more gradual than a hypo. It's not such a dramatic change in symptoms. And then the persistently high blood sugar does need treatment to prevent complications, because, as I said, if it carries on, then you develop diabetes. And then if left untreated, we go into all of the different complications that I mentioned at the start. Next slide, please. Right, so a few common myths. So number one, sugar causes diabetes. So eating too much sugar doesn't cause type 1 diabetes. That's autoimmune. That's your body's own immune system attacking your pancreas. Type 2 is more of a complex mix of genetics and lifestyle factors, but higher sugar consumption leads to weight gain. If the weight gain is around the middle, it's a risk factor for diabetes. The next myth, people with diabetes can't eat sugar or sweets. So taken in moderation, diabetics can have sugar in the diet. The key is to get the body to process it. So whether that's in a type 1 diabetic, that they need to take an additional dose of insulin, or if they're a type 2 diabetic, then taking some exercise after. So as I said, either the heel toe raises if at your desk, or a gentle walk around for 10 minutes after eating something sugary. The next common myth, diabetics need to eat special foods. That's not true. Foods labeled as for diabetics don't offer any real benefit. They're often processed. So the focus should be for all of us on freshly prepared food that's high in protein and fiber. You're just paying over the odds for something that is like diabetic friendly, potentially. The next common myth, only overweight people get diabetes. So excess body weight is a risk factor for type 2 diabetes, a fairly major one. But as I said earlier, people of all body types can be diagnosed. And type 1 is completely unrelated to weight or lifestyle anyway, because that's the immune system attacking the pancreas. And actually, those people tend to lose quite a lot of weight and can't maintain any. But that's our younger population, as I said. Next slide, please. Right, next common myth, pre-diabetes isn't a big deal. So if you are told that your blood sugar level is in the pre-diabetic range, it is a crucial time. Make the changes now to your lifestyle to try and halt the progression to diabetes, because once you're diagnosed with diabetes, that diagnosis can't be taken away. If you make lifestyle changes to keep your diabetes under control, then you can go into what we call remission from diabetes, but nonetheless, the label is still there. And so the wider implications that has for you, for travel insurance, et cetera, So if you're diagnosed with pre-diabetes, crucial time to act. The next common myth, type 2 diabetes is mild compared to type 1. So if left untreated, both types can make the kidneys fail, can cause blindness, can cause nerve issues, and can increase the risk of heart attack or stroke. So we must take type 2 as seriously as we take type 1. Next common myth: once blood sugar is controlled, you can stop medication. So as I said, some people diagnosed with type 2 diabetes are able to manage the condition through diet and exercise, and they don't need to have medications from us, because they can then, with sufficient lifestyle changes, they can bring their blood sugars back into range, and they can just manage it with their lifestyle. However, if that's not the case and you're prescribed medication to lower blood sugar levels, then you do tend to need to stay on it unless significant lifestyle changes are made. So as I just touched on earlier, some people make such drastic lifestyle changes that they put their diabetes into remission, which is a newer concept that we're starting to understand. It's not a cure, and the lifestyle changes need to be long term, because otherwise, if blood sugar starts to creep back up again, then we just go right back to square one. Next slide, please. So when should we seek help? So if you notice any of the symptoms that we've talked about, seeking medical advice via your GP, having the NHS health check, private health check, etc., can make all the difference. So if you're suffering from excessive thirst, frequent urination, fatigue, unexplained weight loss, so you're losing weight or muscle mass even though you're not trying, slow wound healing, so cuts, grazes, ulcers that seem to be taking a long time to heal, can be a sign that the blood is too sugary, and therefore it impairs wound healing. Blurred vision, so if you are starting to notice that you're squinting a little bit, we can't just put it down to the change in eyesight in middle age and whatever else. Book an optician check, they're so easy to get. And then recurrent infections, this is another one. So frequent episodes of genital thrush. So thrush is a type of fungus, and fungus thrives in sugary environments. So if you are somebody that's prone to it, check your diabetes status. Next slide, please. So our take-home messages: recognise diabetes early. It's a manageable condition if you make dietary and lifestyle changes or you adhere to the medication that's prescribed. Make the lifestyle changes now. Prevention is better than treatment.